In this video, I'll be going through some common mistakes which I've seen with regards to CPD entries. So this is just an example of some mistake which I've seen, which I believe that we can discuss, and then I'll provide ways on how to address this or how to ensure that your activity is compliant. So before I start the checking process, I just want to bring to attention that I use a checklist. So the checklist that I use, the first thing I'd be checking for is I'll be checking if your evidence has a title. Two, if there is a description of what this evidence is showing. I'll be looking for the application. And then finally, I'll be looking for any link to the behavioral statement that is being addressed. Okay, let's get right into it. First, let's see um, what's happening here. So we can see that I believe this is the title of the evidence and it's written as E5. It's okay to write it like this, but you can improve it. Instead of writing E5, I believe you can write evidence 5. So this just shows the person who will be assessing your work that, it's more professional to just put it like this. And then I can see here that there is 2.2a. I believe this is the link um, to the behavioral statement, but again, it can be written better. You can write in full. You can say linked to BS, and then you say A. It's okay to write BS instead of behavioral statement, but whichever one, just so that the person who is checking your work sees what's going on. And then I believe this is the description, and it says evaluating a prescription. This person linked with behavioral statement A. Behavioral statement A, according to the intern tutor manual, is about assessing patient understanding of the medical condition and the medicine that's prescribed, and then identifying a counseling need. And then if you're just going to write evaluation of a prescription without a description of what's really going on, it's not sufficient to provide proof that you understand what's done here. But it's okay. It's okay. We'll see how we can fix it. And then going through the evidence, we can see that according to this, there is then there are annotations. Okay, let me just first see. The first thing that you'd want to check for whenever you have your evidence is, any breach in confidentiality. So we can see here that confidentiality is maintained, and here it's also maintained confidentiality. So this is good. Remember that if you breach confidentiality, no matter the quality of the evidence, or even if you provided everything according to the requirements, if there's a breach in confidentiality, then it's not going to work. So this is fine. Let's check for other breaches in confidentiality, such as patient's ID number, signature, and all of those things. There is the sex of the patient, it's okay. The age of the patient is okay. The address, it's not entered, but sometimes they don't. Okay, for this CPD, we're not going to check on that. And I see that there's hypertension and details here of what's going on. And then the date. Okay, let's now go to the annotations. So here, with the annotation, this person went on to say that this is the patient name and surname. Okay, the patient age and gender, the date of the prescription. Okay, so this links to this. And then going down with the annotation, we're going to check other aspects. So they're saying that the names of the medication the patient is taking, dose, frequency, and duration of treatment, signature, and practice number of what's going on here. Patient diagnosis, pharmacy signature, and the date of dispensing. So now, whenever you provide evidence for your work, you need to check is the evidence that you are providing, one, relevant to the behavioral statement or the competency standard that you are assessing. Two, you also need to make sure that your evidence is current. So that means it needs to be collected in the year of the internship. Let's just leave this like this for now. So now, since this person was saying that they are applying behavioral statement A of domain 2.2, but they speak nothing about, assessing what the patient understands about their medical condition or the counseling need, then it's not enough to to prove that you complied with behavioral statement with domain 2.2a. Let me add something here and say that your evidence needs to be sufficient. So it needs to be sufficient to provide proof that you apply behavioral statement, the specific behavior statement, or the competency standard, if we're then evaluating the whole CPD. So now, with all of this said, um, how can we then improve the quality of this evidence? Because yes, it's okay for you to provide a prescription that you evaluated, that you applied this specific domain. But how can we make sure that you then improved on the quality of this? One, remember the checklist that we are using. I will then say this is evidence 5. Okay. And then next to it, I will say it's linked to behavioral statement A. Okay. And then underneath, I will add, a description of what this shows. I will say this is a prescription brought by the patient that I used to obtain understanding from the patient and establish a counseling need. I am saying this because I am applying behavioral statement A. Remember, behavior statement A is assessing the patient's understanding of the medical condition and of the medication that is prescribed by the doctor, and then establishing a counseling need, because I don't want to just counsel for anything, but I need to have a specific need that I have. This is okay to say, but how I can improve this is I would say, let's say behavior statement A. I link it with behavior statement A, link, and then I would add annotations underneath. I would say the patient wrote a prescription on the 5th of the 5th, 2025, and then I took them to a private consultation room and asked open-ended questions to establish a counseling need. So I'm mentioning the date, but I'm focusing on behavioral statement A about establishing a need. I'm also talking about where I did the counseling. It's an appropriate counseling area, and then I'm asking the patient specific questions. Still on behavioral statement A, I will speak about the medication that the patient is being prescribed. First, I will link to the behavioral statement. I'll say this is behavioral statement A, and then underneath, I will add a text box here. In the text box, I will communicate about the medication that the patient is being prescribed. So now I can see that the patient is being prescribed hydrochlorothiazide, Panado, UMS, which I believe is methyl salicylate ointment, Beclate, and Astavent. Okay. Before the annotations, let me just make this comment. Since you are evaluating a prescription for dispensing, is this the right way of writing a prescription? Because they only wrote Beclate 2 puffs BD, Astavent 2 puffs Pira-N. What does this mean? What is the dose? Is this the right dose? How are you going to provide counseling if there isn't a specific dose for the patient? So before we get to the annotations aspect, I think we need to address some prescription problems that we have. So since this is now something that we identified, what are we going to do? We are going to communicate with the doctor. So we are communicating with the doctor to address this prescription anomaly so that we're able to counsel the patient properly. Normally, the dose, I think, for adult patients is 100 micrograms. PD, but you can confirm that with the doctor. This is to demonstrate that you are able to counsel the patient. This is also because behavioral statement B needs you to provide counseling on the use. How are you going to ensure the rational use if the dosage is not provided? But let's just focus on behavioral statement 2A. So for behavior statement 2A, what I will go on and say is I checked with the patient, or I checked the medication that the patient is prescribed. I saw that the patient is prescribed hydrochlorothiazide, paracetamol, methyl salicylate. I then communicated with the doctor and confirmed the dosage of the beclomethasone and Astavent inhalers. I then asked the patient open ended questions to check what they understood about the inhalers that they are prescribed and the rest of the medication. I then waited for the patient to respond. The patient said that they know how to use the hypertensive medication since they've been using it for years, but they were recently prescribed beclomethasone. I'm just adding a scenario. They were recently prescribed beclomethasone inhaler and this other one to control a tight chest. So after this, I established a counseling need, which is to counsel on inhalers. I'm counseling on inhalers because they don't need counseling on this and this and this. But I'll provide, the labels and all of those things. So to repeat that, I will start off by saying linked with behavioral statement A. And then in the annotation, in the text box, I will say I began by checking the prescription and saw that the patient was prescribed hydrochlorothiazide, paracetamol, methyl salicylate ointment. I then confirmed with the doctor via telephone, and the doctor told me that they wanted to give 100 micrograms, 2 puffs PD of this. I went on to ask the patient what they understood about any of this medication. They said that they understood what the hydrochlorothiazide was for, the paracetamol, and the rap, to put it plainly. But they weren't sure how to use the inhalers because they just got them for the first time. This became a counseling need. Okay. And then I can go on and add other information. Here, the name of the medication, the patient, the duration of treatment. It's fine. But to improve this, I can say that this is linked with behavioral statement B. Okay. I am linking it with another behavioral statement. I will explain how I can address this and to just bring clarity on this since we are already seeing that there is a prescription anomaly here. Behavioral statement B speaks about providing counseling on the rational and safe use of medication. So already we can see that there is no dosage here. So how will the patient know how to use the medication? So to improve on the annotation with this, I can mention what I said about communicating with the doctor. So communicating, and then I can mention about what I advised the patient on. Advised. Okay. So what guides me is the requirement of the behavioral statement. Since this is behavioral statement B, behavioral statement B, I need to counsel the patient. So in order to counsel the patient, I need to ensure that the medication that they are written is safe and effective, and the way that the prescription is written is fine. So I will communicate with the doctor via telephone, or I communicated with the doctor via telephone. I explained to them that there is a patient who was prescribed the inhalers, but there was no dosage on it. And then the doctor said they remembered, excuse me, the patient, and then they clarified that they wanted to give mhlambe, let's say we're just making an example, 100 micrograms, and then say 2 puffs PD. This is communication. And then I document this in the prescription. Maybe I put in a note somewhere here and just explain that on this specific date, I add the date. And then I add my name here as maybe let's say the intern, communicated with the doctor and explained or checked what the dosage for the beclomethasone was and the Astavent, and they clarified it, and then I write what the doctor said about this medication, which is this. I then went on to pick and label the medication and label the medication according to the doctor's instructions, and then use this label to counsel the patient on how to use the medication. This can then be linked to behavioral statement B. The reason why I am adding this, even though it's just behavioral statement A here, is that now I have an opportunity to cover another behavioral statement. But if possible, just stick with one behavioral statement. But in this case, since I am linking it with another behavioral statement, I will then say behavioral statement A and B. Now let's go back to our checklist. So I said I will check for a title. This is the title. It's evidence 5 of the evidence that you're including. A description. This is a prescription brought by the patient which I used to establish a counseling need. So check. Application. In the application, I annotated appropriately here to say how I would apply it here, how I would apply it just down here as well, so that I am able to show the application. And then the link with the behavior statement, you can see that I'm adding specific links and then I link with that specific place whereby I am applying that specific behavior statement. So it is A and B. So now coming back to the other checklist that I told you about when checking evidence to see if your evidence is relevant, current, and it's sufficient. It is relevant because I'm addressing behavioral statement A. Okay? But it may not be sufficient because I did not check with the patient. I can add other pieces of evidence like counseling notes and other things, but it's fine. Just for A, let's focus on this. And then it's current because it is taken in the year of the internship. So if the internship is in 2025, this is taken in 2025. It also has this as taken in 2025. It is sufficient um, because I am addressing behavioral statement A. There may be other pieces of evidence that I am adding to cover for behavior statement A. Pieces of evidence such as, let's say, I'm taking counseling notes. In the counseling notes, I'm asking other things about, the disease condition because I can see that the patient has hypertension and has asthma. So I ask to see what they understand about hypertension and what they understand about asthma, and then I establish a counseling need. So we establish the counseling need here as being counseling on inhalers. Let me change a pen here. So on inhalers, and then maybe they understand about the hypertension, but they don't know much about asthma. So I can have their counseling need as counseling on asthma as well. So in the notes, I can explain that this was the need, and then I also added counseling information on asthma. So then this proves, or this can be a way to show that this evidence is sufficient to prove for behavioral statement A. Behavior statement A being, establishing the understanding of the patient of, a medical condition and the medicine prescribed, and then establishing a counseling need. I hope this helps.